You do not need to be on your period at the time of your IUD insertion. Sometimes that can help with the insertion because your uterus will be open, but it is not required at all. And sometimes that's just really hard to schedule. So we'll just try and figure that out based on you and your schedule and your cycle and your provider schedule. You do not need to have had a baby prior to getting an IUD. Sometimes that does make the insertion process a little bit easier, but certainly here at our health center, most women have not had a baby prior to getting their IUD. You are not at an increased risk of sexually transmitted infections with an IUD. Just like any other form of hormonal birth control, the IUD does not protect you against getting a sexually transmitted disease, and so we do recommend using condoms all the time with all of your partners during vaginal and oral intercourse as well. And we still recommend getting tested once a year or with any change of your partner. The IUD will not affect your fertility at all, and so once you have the IUD removed, your fertility will return back to what it was at that specific age. There is still a very small risk of pregnancy associated with an IUD if you're having otherwise unprotected intercourse. Remember that the IUD is over 99% effective as a form of birth control, but it's not 100%. Nothing is. So we do still recommend using condoms as a backup form of birth control. You may not know that you're pregnant if you have one of the hormonal IUDs because you may not have regular menstrual cycle or bleeding. And so if you have any questions about that, or you're having pelvic pain or any other concerns, you can always take a home pregnancy test or come into the office and we'll be happy to do a pregnancy test for you as well. There is a small risk of an ectopic pregnancy with the IUD. So while your risk of pregnancy is lower while you have the IUD, the risk of an ectopic pregnancy when you have the IUD is a little bit higher than if you don't have one. That risk with the Mirena IUD is quoted at 5 in 10,000. So still a very small risk, but a risk nonetheless. The symptoms of an ectopic pregnancy would be pelvic pain, irregular bleeding. So if you have any of those concerns, you can always take a pregnancy test, and that would be positive if you do have an ectopic pregnancy. There is a 2% risk of expulsion of the IUD, which means that the IUD could come out of your uterus. Typically you would feel that in that it would be very crampy, but sometimes you don't have any cramping. And so it's important to do monthly string checks if you're able to do that. And you should be able to feel your